So it is actually not true that you have to cut sugar completely out of your diet. Our bodies need energy and the source of glucose. So we need to get that in the form of different nutrients. And if we don't get it in our diets, our bodies are able to actually make it from protein. And it can actually take away from our protein stores and take away from our muscle mass and cause like a compromised immune system. So we want to focus on naturally occurring sugars in foods such as milk and fruits and vegetables and whole grains, and less on added sugars. So it is important to focus on high protein foods to help recover during active treatment. A lot of times our meats are the highest sources of protein in our diet, but if you can't tolerate those during active treatment, you can always utilize dairy products, nuts, nut butters, or eggs. And if you can't tolerate any of those sources, you can always resort to Ensure or Boost or other nutritional supplements. So there are a lot of foods on the internet that say that they help prevent or protect against cancer. And it's important to keep in mind that there's no magic bullets or miracle food out there that's really going to help completely protect against cancer. It's more important to focus on making the majority of your diet consist of fruits and vegetables, whole grains, legumes, and beans. It's actually recommended to get your vitamins and minerals from whole foods over any type of vitamins or herbal supplements. A lot of times the nutrients in foods act together to provide the positive benefits, and when they isolate a single nutrient, they don't have as many positive benefits. And even in some research, it's shown that high doses of certain vitamins and herbs are associated with an increased risk of cancer. Boost and Ensure are great products to utilize if you're undergoing active treatments. In certain cases, you can get away with just drinking one a day if you're just trying to maintain your weight, but you're kind of not eating as much as you were before treatments. In other cases, I encourage use up to 2 to 3 in a day if you're really struggling with weight loss, appetite changes, nausea, vomiting, and other symptoms. A good diet if you're struggling with nausea and altered taste is to try to consume 5 to 6 smaller, more frequent meals in a day rather than 3 large meals. Try eating bland, dry, and foods that don't have strong odors so they're less prone to make you sick. If you're struggling with metallic taste, trying to utilize plastic spoons over metal spoons can help with that. If you're having altered taste, you can also try and use hard candies like Lifesavers, lemon heads, or try using a baking soda, salt, water solution to get rid of any aftertaste in your mouth. My best advice I would offer to a cancer patient undergoing active treatment is to just remember to eat. A lot of patients undergoing active treatments really suffer from loss of appetite, taste changes, nausea, and sometimes they forget to eat. And you need to remember that food is just as important as medicine is. My most important piece of advice that I would offer a cancer survivor is trying to focus on maintaining a healthy weight through diet and exercise, and really focusing on fruit, vegetable, whole grain, legume, and bean intake to maintain that healthy weight and to really help promote your health and well-being in the long run.